everybody, to the Empower Performance Podcast. Today's special guest is Katie Dabrowski. Katie, if you don't mind telling us a little bit about yourself, what do you do and how did you get into it?
Yeah, for sure. Hi, everyone. Thanks for having me. So, yes, I'm Katie. I am a physical therapist and a strength coach. And I'm co-owner of kind of a hybrid rehab strength and performance facility in Miami. We currently have two locations. Third one is on deck. We're Old Bull Athletics, and kind of our goal is to really disrupt the very traditional model of what physical therapy and rehab looks like and make it very strength and movement based and help people not only get through like an experience of pain, but see it as an opportunity to help implement things to make them healthier, big picture wise, across their lifespan. So, working on big picture things like increasing their muscle mass, building their aerobic system up, helping with like some of the psychological resilience that is necessary and really helpful for people dealing with pain. And honestly, just trying to make training and exercise fun. I wear a few hats. I also teach in the undergraduate neuroscience department at Nova Southeastern University, where I get to teach some neuroscience classes, which I love. And I'm involved in quite a few kind of organizations where, again, our goal is to really just like blend the worlds of rehab and training. So that's kind of the rundown.
That's awesome. That was actually one of my later questions is how do you juggle it all? Because you do wear a lot of hats. Education is impressive. What you're doing in your actual field of personal training and physical therapy is impressive. And I believe you also have a background in neuroscience and you get to blend that into your physical therapy. So, I mean, you're a very impressive person. I'm curious how you
Oh,
balance it
just
all.
busy, right? I think we're all
Yeah.
just busy. That's really my issue is I probably I perform best with a very full plate.
Yeah.
So
Okay.
I'm sure that's relatable. Most people in the field kind of feel that way. But yeah, I balance is tough. That's the tricky part of all of this. I'm constantly trying to get better at it too. But I think we are in a unique and lucky type of setting where it becomes easier to say yes to these things because we like it and we're so
Enjoy it. Yeah.
passionate about it. But yeah, the balance side of it, I'll let you know when I have it
When you figure
figured
it
out
out.
because I don't quite yet, but
Yeah.
I'm working on it.
Yeah. Please discuss your background in neuroscience. How did you switch from neuroscience to physical therapy? And I was listening to your podcast on Coach 'em Up,
Mhm.
and I remember you talking about how originally you thought they wouldn't relate at all, and you thought, how could they not? They're so intertwined. So if you could speak to that a little bit, I'd appreciate that.
Yeah, I remember after, my whole goal kind of being in the academic side of things was to study neuroscience and become a researcher and a professor in the field. And that was kind of what I had set up for. Every action I took as a student kind of was the goal to get there. And then when I had the realization of not wanting to do that, I was like, oh my God, what have I done? Like, why did I do like the hardest thing and spend all of this time doing something like this to now not actually think that I want to be completely in that field. And I remember at first feeling like it was not a waste of time, but almost like, man, I really did so much kind of for nothing. And now that could not be farther from the truth for the stage that having such a strong foundation in not only neuroscience itself, which is highly important for anything that we do from a rehab perspective, but I think even just like the rigor of the case of the coursework and the extreme like expertise and experience in the research side of things, being able to analyze literature, being able to write and publish articles, having a really solid foundation in kind of the science research world. I think those are invaluable skills even beyond just what the foundations of like knowing a bit about the brain and how helpful that is, but all of it together I think set the stage for me to be a much better practitioner to understand the nervous system and how every movement and everything we do is impacting the nervous system. Now it's silly to me that I ever thought that it wouldn't be helpful. But you know how it is when you're young and you think that your life is going to go one way and it goes another and you're like, "Oh God, what have I done?" That's kind of how it felt in the moment, but now I feel that it was extremely beneficial.
Um, so you obviously understand the complexity of pain. That has to be a huge thing that you work with your clients. I imagine the traditional thought and something you might see in a lot of the traditional PT settings is pain is a red flag. You don't avoid pain as much as possible. And
Hmm.
I believe that your mission statement or something along the lines is that you want to reframe physical therapy to train in the presence of pain. If I'm not mistaken, something along those lines. Can you speak to somebody to not fearmonger pain? How can they still
Mm.
feel resilient but also not do additional damage? What's that healthy balance look like?
Yeah, that's the toughest thing that I think most people struggle with so much. Um, and it's stuff that like I'm always very clear in that despite having what I would maybe consider well on my way to expertise in this area, I still spiral every time I have pain.
Yeah.
Like it's a very human thing, and I like to share that with people too to humanize the experience. Like our brain's job is to keep us alive. Like that's its number one goal with everything that it does. And pain is something that is threatening to the brain's ability to do that. And it makes perfect sense that our brain would be set up in a way that makes us try to avoid pain at all costs and to make us really scared of it. It's a survival technique. Where it becomes less helpful, though, is when it's not, in fact, something that is life or death. And that is the vast majority of the pain experiences that we do go through. Whether or not it feels that way to us in the moment is one thing, but I often like to share that side of it and help humanize the pain experience because it's an inevitability. Every single human being is going to experience pain, and going through uh, a pain experience does not mean that it's going to forever go away. And it's not to say that we can't help people get out of pain and in quotations, fix it. It's more of just this understanding that it's a part of the human experience. And I think that's a very valuable talking point with our clients. So that part of it and normalizing it and humanizing it is a big, big component of the conversation. But then also, um, you know, it's very rare when pain in our settings that we deal with is actually a red flag. And
Sure.
I explain this to clients. When it is a red flag, there are very specific things that we look for, especially for our purposes. It's more of, is it a red flag for something that's out of our scope of practice? Something that is neurological beyond what we are able to deal with, something that could be related to other body systems and organ systems that isn't within what we deal with. And that's really the only scenario when pain should be considered a red flag. Otherwise, it's a data point. It gives us information on what your body can currently tolerate versus maybe what it needs to be able to tolerate for your goals. And it's not to say that that's magically going to make people feel okay about pain, but it at least helps the conversation.
Along those lines too, a lot of people when they're in pain, uh, I guess their main conception is to just avoid whatever movements causes pain for as long as possible, hope that it heals itself, and then
Hmm.
go back to whatever it is with zero resiliency whatsoever. Do you think that there's a different or better way to deal with pain rather than avoidance?
Yeah, absolutely. I mean, it's kind of, I think everybody has gone down that path themselves before of, well, I can't do this thing, so I'm just going to stop doing it. And then trying again, and it hurts. And it's a little bit of a self-fulfilling prophecy of like, see, I knew this was bad, or I knew I couldn't do this. I don't know where I originally heard this from, but it's always an example that I find really helpful, even for clients. Like, if there was something wrong with your car and it didn't turn on, and you just kept it in your garage for 3 months and then you tried to turn it on again, would you expect that it suddenly
I
started
like that.
working?
Yeah.
So, yeah, I have no idea where that's from. Like, full disclosure, did
Yeah.
not make that up. But I think it's a really good analogy because pain is an active thing for us to work on. It's not something that just means that, well, you're done. You need to avoid this forever. If we don't find an entry point, if we don't find all of the ways that we can continue to move, whether it's moving in a way that doesn't trigger us or finding that way to move, that can start to kind of etch away at maybe the most painful or the most fearful pattern that somebody has, we're not going to actually make a change to our tissues and to our brain and to our psychology to be able to tolerate the things that we want to get back to. Avoidance would be the option if you just didn't want to do anything ever again. And I don't really think most people seeing a physical therapist or a strength coach or an athletic trainer or a chiro, I don't think that's why they're coming.
Yeah. So somewhat along those lines, I'm a personal trainer and strength coach, and my dad was a pain avoidant person for many years. He had back pain for maybe a decade. And
Hmm.
when I first started training him, we started with something super easy like kettlebell deadlifts, maybe 40 pounds or something like that. And he said, all right, this is fine. I don't need to go heavier because I can feel my back. It's a little sensitive, maybe 1 out of 10 sensitive. He's like, I just never want to push. I don't want to hurt myself or anything like that. And I would tell him, God forbid you have to pick up a 50-pound package because
Yeah.
you're not going to be able to tolerate that. So it's like you can right now just decide for the rest of your life 40 pounds is your max, or you can just play around with this 1 or 2 out of 10 pain, sensitivity, whatever term you want to use. Just kind of ride that line and watch as you get stronger that your sensitivity may actually decrease. And for the first time in 10 years, he's deadlifting in the high 200s, 275, as
That's
this like
awesome.
this little 5'4" Frenchman, and he's also pain free in his back and all that stuff. And that's one of the main things I try to teach people is that pain doesn't always inherently mean damage or increasing damage. It is possible to train through pain, and tolerance is probably the most important thing. The difference between rehab and injury is really just the dose, in my opinion. Too much too soon,
1000%.
too much too soon after too little for too long is the recipe for injury. But if you actually just progressively overload one of the most fundamental concepts in all of training, and you just use a little bit of common sense, and you don't do so little that you're avoiding pain altogether, and so much that you're hurting yourself even worse. Just find that pretty sizable sweet spot, and you do it consistently. I find you can rehab pretty effectively. I'm not trying to make your job seem that simple. I'm sure there's a lot more complexity to it, but
Oh,
you
you're pretty spot on.
know.
Yeah. No, honestly, that's very similar to exactly how I explain it to people. And I was just speaking with somebody before you of I really think our industry tries to overcomplicate things to almost like validate our degree and
Yeah.
validate how much school we went through and how much money we paid for that we will be continually paying for forever, to overcomplicate things when in reality I think the exactly what you just said is so spot on. It's a dosage thing, and it's a Goldilocks amount between too much
Sure.
too soon or not enough ever.
Yeah.
And I think that is the message that I want more and more people to get for so many reasons. It demystifies and demedicalizes a lot of people's pain experience because not everything is a medical condition. Not every experience of pain is a medical condition that needs this hyper specific diagnosis and something to make people feel scared of. Like, very frequently, sorry, my dog's barking at somebody at the door. Um, Very frequently, it's exactly what you said. It's a dosage side of things. Like, oh, you decided to take up running and you haven't gone running in 10 years, and the first run you did was 5 miles.
Yeah. Yeah.
That's kind of going 0 to 100. Like, you're sending it beyond. Like, when's the last time you've jumped up and down over and over again for an hour straight? That's what you just did on your run. So if we reframe it that way, I think it helps people see that not every pain experience has this very life or death scenario or this need for a very medicalized lens of it.
Um, Another thing too that I'd like to ask you your opinion about is I find that some people will demonize certain movements,
Hmm.
and then I'll see people in Cirque du Soleil doing things that you don't even think the human body is capable of. I think it goes along those lines, but is there any movement that you think is inherently dangerous or risky, or that people should avoid, or is it still kind of along those lines of graded exposure over time?
Yeah, I'm still a huge proponent of graded exposure, and I also think that um, kind of reading the room and who your client is important too, because I think we can go really far kind of down the extreme side of things of like, movement optimism, like no movement is bad, everything is good.
Yeah.
And while I do believe that, and that's kind of like a general premise that I think is important, it's also, the first time you ever have a client deadlift who's never deadlifted at all, they might feel more comfortable in a position where their spine is a bit more neutral.
Neutral. Yeah,
Like, it
absolutely.
doesn't mean that it's the safest way to do it, the only way to do it, the right way to do it. It just means that somebody who has never, ever, ever done this movement before, who probably has heard from several people in their lives that deadlifting is bad for them or it's going to hurt their low back, there's probably a way for us to set them up where they're going to feel really confident and maybe learn how to create tension in the tissues that we actually care about stressing for them. So, the my joke person that I always say is like Karen from accounting who has never lifted before. Maybe day one, we don't have to do a deficit Jefferson curl just to prove a point that all movements are safe. Because Karen from accounting has never felt a low back pump before, and
Yeah.
she's going to think she just herniated all of her discs.
Yeah.
So I think by and large, no movement is off limits, but we do have a responsibility to think of who we are prescribing certain types to.
Yeah, kind of along those lines. When I start training clients who say they have back pain or anything like that, I don't want to scare them off too quickly. So we're not going to do GHD sit-ups or anything like that. I
Right,
want to do
right.
front planks, teach them how to brace, let them develop some confidence and all that stuff. Maybe some back extensions. Very, limit the range, limit the weight, limit the load, the volume, whatever. And just they'll say, "Oh, I feel it in my back," and I'll ask them, "Do you feel it in the joints? Is it a sharp pain, or do you just feel your erectors waking up for the first time in years? Do you feel the muscles working? Is there a pump? Is there blood flow?" It's actually not a bad thing. You just have to build a
Yeah,
tolerance, and eventually, they're comfortable trying some of those things you're talking about, maybe a Jefferson.
yeah.
Um, but right off the bat, yeah, that's a really hard thing to convince someone.
And I
Um,
think it's a good way to use it as like a way to very casually talk about where they might be
sure,
feeling this stuff. Like
sure,
when I'm working on any kind of hinge pattern with people, I'll usually tell them like when we're doing this stuff, we're basically working the entire backside of your body. That includes your back muscles too.
yeah,
And you're probably going to feel some work there, and that's totally okay.
yeah,
Most people don't stress those muscles a lot. So sometimes it can be a little bit weird to feel effort there. So you just let me know if anything feels like it's too much work in those muscles. And when I talk about the back with people, I've mentioned this before too. I very specifically say back muscles always.
yeah,
Because when we say back, people think that the only thing back there is their literal spine, like just waiting to explode. Like, I
yeah.
think that's what people think. So I very clearly and very purposefully say back muscles every single time I talk about it. And I find that does make a difference.
Great. So you seem very passionate about your work. What is the most rewarding thing about it for you? Do you have any examples that would come to mind?
Oh my gosh, that's a good question.
Yeah,
I kind of think of it in twofold. I think of it the from like the team side of it with the Old Bowl team. We have so much fun and I get to learn alongside some of the most phenomenal people in the field and in the industry. And I think getting to do that with people who are equally passionate and excited about what we do is probably one of my favorite things in the world. Being silly and just creating an environment where people can come in and feel really safe and have fun. Training and moving their body is probably one of the coolest things ever. And then I think the other side of it is kind of, I think, the obvious answer that most people would give, like helping somebody achieve something that they didn't think was ever going to be possible, whether it was a goal for them or exceeding a goal that they didn't even know that they had for themselves. That really doesn't get old ever. Like it's pretty fantastic to get people to do that, especially I consider myself and the population I work with to be like general population, but people who are maybe more on the slightly higher active side of that scale. And to me, there's no better feeling in the world than giving somebody the opportunity who maybe doesn't think that they're athletic or maybe doesn't think that they're strong and making them feel that way. It's pretty cool.
yeah, I had a client telling me today that he lost 80 pounds over the past year or so, and he was talking about how his life is different because of that. And he was saying he used to not be able to paddleboard; it was too difficult for him. And he's improved his strength, he's lost some weight, he's improved his balance, so he's able to paddleboard. But he also said when he was pulling up to the dock and trying to step off the paddleboard onto the dock, he lost his balance and was able to fall and catch himself and avoid injury because we train power, we train strength. He's able to express strength quickly enough to catch himself and not hurt himself. So, and he said he felt like a superhero, like a superhero landing in the movies and all that stuff, just being
That's
able to catch
so
himself.
cool.
And so someone might think that, I remember when he first got a six pack and he was telling me and he was beaming and all that stuff. And I was happy for him. Or when he first deadlifted 450 for the first time or something, I was happy with that too. But the thing that brings me the most joy is hearing how the quality of life improves.
Yeah.
Or you can just do things that you weren't able to do before. So I like to say, maybe not to clients because it might, turn them off, but their first goal is always my second goal. My first goal is to keep them healthy and improve their
Mm,
quality of life. And then if they say, I want a bigger butt, I want bigger arms, all that stuff, cool. But
yeah.
like if it means we're going to chase that and we're not going to take care of your health and you feel beat up all the time, that's not really why I'm in it. If you can feel great and then also achieve your goals, then it's a win-win and we're all happy.
I like that phrase too, that your first goal is my second goal. I like that a lot. Yeah, I agree. There's things that it's pretty cool, especially people who have never really trained before. The things that I find often more exciting are when they realize they're like, wow, I didn't realize how hard it was for me to go up and down stairs. And now, like, I don't even think about it.
Mhm.
Those things that I think people like us who have been training for a long time maybe can take for granted,
Yeah.
and forget about when
Mhm.
that people do struggle with some of those things. And then when somebody, even beyond, as you were mentioning, like the weight being heavier on the bar that they're able to do, but like the day-to-day stuff, that's
Yeah.
pretty cool.
Yeah. Um, So, can we talk about your training for a second? Because you post clips on Instagram, and I don't think people understand. You're just plain strong and super fit. And I wish everybody had the good fortune to have a physical therapist that trains the way that you do and walks the walk. And it's not just 3 sets of 10 with really light bands and a couple stretches and a lot of massage. Can you speak to how you think that may help you as a physical therapist in terms of your lens and how that may apply to your clients?
Yeah. Well, thank you, first of
Yeah.
all. I do, yeah, I love to train, and I also understand that not everybody I work with maybe wants to train exactly the way that I do, which is fine. But I do think if I'm going to show that I'm really passionate about getting people stronger and being very movement based, that I should also do the same thing. And the passion for how I treat patients and clients comes directly from the way that I like to train and how empowering it feels to be strong and how resilient it feels to, I think people often have the misconception that, oh, I just must never have pain because I'm strong or I don't get injured. I still have stuff happen to me, absolutely, but the resiliency side of it and knowing that, well, I trust my body and I trust my tissues to help me get back to where I was, like that's something that I want to give people. I think most people don't really even understand that they have a say in their pain experience. By being stronger and being more resilient and being able to tolerate more stuff, your body can handle more things. And even a pain experience that inevitably can happen because we're human, you can get through it by having these qualities of strength and muscle mass and being metabolically healthy and fit. And all of those things come into play when we're dealing with pain or injury. So I like to train in a way where like the thing that I keep saying and that's kind of gotten some traction is being confusingly jacked at every decade. Like I want
Yeah.
people to be concerned about what I'm
Yeah.
doing. um and I say that like because it's funny, but also it's entirely how I feel. Like I think people have such a misconception that aging is just this inevitable downward spiral of doom and everything has to suck. And I'm not saying that there are things that don't change. Of course things change, but I firmly believe that going into each decade as fit as you can with the idea in your head of I want to see how much I can do in this decade of life versus the thought of like, well, it's just going to keep getting harder because I'm getting older.
Yeah.
That's something that for me is a non-negotiable and I want to try to like impart that on other people too. So that's why I train the way I train.
Yeah, I'm approaching 30 now, and I have my friends already saying I'm getting too old, and they're talking about all the joint pain and this, that, and the other. And I don't want to name names for friends specifically, but I'll see people in my generation. I'll say that instead. We'll just be
Yeah.
sitting on the couch, Netflix all day, very little exercise on their phones and all that stuff. And it's like, man, if you just got out and did a little bit, you might not feel so old. You know, you see, have you ever seen that docu series on Netflix called The Blue Zones or something like that? It
Oh,
was
I know what
talking.
you're talking about. Yeah. I
Yeah,
haven't
yeah.
seen it, but I know what you're talking about.
In that they found 80-year-olds doing muscle ups, calisthenics at like local parks, and one guy doing martial arts and he's doing the splits and jumping around and all that stuff, and he's like 80 years old. It's like that's not a coincidence.
Yeah,
They're training their speed, they're training their strength, their resiliency, and all this stuff, and I bet they feel much better at 80 than a lot of my friends and peers my age do in their late 20s, early 30s, and all that stuff. So if ever there's
yeah,
a selling point for the fountain of youth, essentially being training, and then also good sleep, good nutrition, and all that stuff, and good social lives and all that. That's that. I mean, people can feel more alive. For me, I used to, in high school, I'm a guy. I started training to get the muscles for the girls and confidence and all that stuff. But now I just train to be physically competent. I don't want to specialize in anything. I like to think of a jack of all trades. If I'm gonna
yeah.
play pickup sports, I want to be able to do this. If I'm gonna work out with a buddy, I want to do that. And now I picked up some martial arts training. I'm doing jujitsu and Muay Thai and some
That's
wrestling and
awesome.
some MMA. And like, I'm getting beat up, literally beat up, and I'll feel bad the next morning. And I just think if I didn't strength train, this would feel so much worse. I'm more resilient because of strength training. And on the days where I feel the most beat up, if I know if I just sit around and do nothing, that pain's just gonna increase over time. But if I just go into the gym and I do even 20, 40, 50, 60% effort and I just get some blood flow and I get moving and all that stuff, certainly that, I don't know, 7 out of 10 pain feels like a 3 out of 10, or that 5 feels like a 2 out of 10. So it's almost like a drug when you see the benefits that it has for you.
Absolutely. Yeah, I think people often think that just it's like I mentioned before, that inevitability of aging just meaning that things start to suck. And it's more of a lifestyle creep side of it, of stacking decades of doing less and less every year. That's the stuff that makes the symptoms with aging happen. Muscle loss and power loss, those are modifiable things. They're not non-negotiables that happen with aging. And we know that. We see people who keep up with these things who don't have those, what we used to call age-related declines. They don't happen. So it's not only an age-mediated thing, it's a lifestyle factor of, well, when's the last time you've jumped? When's the last time you've done something really challenging for your body? If that answer is several years ago, then you are going to feel the effects of aging that do feel like, well, this is just getting bad because I'm getting older. No, it's getting bad because there's more time now between where you are and since you have last done something active, and that's just increasing every year.
Along those lines, too, you're talking about power and loss decreasing with age. So does bone density, especially in women. Osteoporosis is very significant, and I have this happen almost every time I have an older female client. They say that they're worried about lifting heavy because they don't want to get too jacked, and I say, I don't want to make a pop chart because I don't want to turn into Gordon Ramsay. If only it were that easy. But I think I'm going to start sending them your profile because you train really, really hard. And I don't think you look like Arnold Schwarzenegger. You are jacked in your own way, but I think
Oh,
that's
I
what the key
don't. I'm
is.
trying, man.
But I think if they saw what you looked like, they'd be like, I want to look just like that. I bet she just does, Pilates. Not to shit on Pilates, but I bet she does
Yeah.
Pilates and eats salads and runs all the time and doesn't lift heavy and all that stuff. If I could show them the clips of you doing chin ups with the 24 kg kettlebell, 53 pounds, and all that stuff, I think that might change their mind that these big scary weights aren't going to destroy them. In fact, it'll make them more competent and more confident. So, yeah, you're a great example. I
Yeah.
appreciate that.
Thank you. That's so awesome to hear. I mean, yeah, I think that's always this pervasive thought of like the fear of getting too bulky. The Pop Tart and Gordon Ramsay, I'm stealing that because that's hilarious. Yeah, like I think people really don't, they really underestimate the amount of effort and time and nutrition and amount to lift and all of that that comes in to truly get that jacked. I mean,
And
nobody
steroids.
accidentally becomes
Yeah,
too muscular. It's
yeah,
really hard to do. I always joke with my clients too of like, I've been trying for years. Like
yeah,
it doesn't happen. Like we're all trying. Yeah, that's a challenging one because
yeah,
the amount of calories somebody would have to eat and the amount of hours they would have to spend in the gym to get too muscular
sure,
is exorbitant.
sure.
So, yeah.
I've only ever seen something even close to it happen once. It was my first client. She was the dream client to have. She said that she gets big arms way too quickly and she likes to wear these tight shirts and all that. And I was like, listen, if your arms get too jacked for your shirts, we'll dial back the direct arm training. And she got to the point where she was like, listen, she like flexed her biceps. I'm like, holy shit. Like, it's like, yeah, your arms are awesome. But like, if you're saying you don't want to do this anymore, that's fine. We'll do the compound movements on the
Yeah.
body. But
That's
I
so
mean, that's,
funny. That's like the dream, right?
yeah,
Like, I
yeah,
just want my arms to be too big for my shirt.
yeah. So the next question I was going to ask is, what changes would you like to see in the PT field? Because you say you do things differently. What is, in your mind, the traditional PT setting, and how can they modernize or reform?
Yeah, I think even beyond, I think some of the easy things to talk about are, getting away from like kind of the cookie cutter insurance model. But I also recognize that that's not possible for every person
Sure.
to be in a setting that's not that way.
Mm-hmm.
I think the bigger things are more just big principles of what our jobs are and what I think are really lacking in terms of the education that we're exposed to, as well as just how we implement the types of treatments that we're giving people. I think we really need to get away from a very specific diagnosis lens unless there are situations where the diagnosis would dramatically change the plan of care. For most things, in the absence of those red flags or things that I discussed earlier, for most things, it's very, very rare when a hyper specific tissue diagnosis would change what I would do with somebody. If
Mhm.
somebody has knee pain, but they haven't had a traumatic event where
Mhm.
something was actually ruptured or injured, or they don't have any red flag neurological symptoms or red flag symptoms from other body systems that are not within my scope of practice. Once I kind of check those boxes that stuff didn't happen, it's very rare that I'm going to care too much of the exact tissue that is involved because that knee needs to be able to bend and straighten. It needs to be able to eccentrically accept force, concentrically produce force. It needs to be able to tolerate running and jumping and cutting and rotating and moving side to side
Mhm.
regardless of what tissue it could possibly be.
Mhm.
There might be some considerations if it's something more of like a chronic tendon issue versus something that just happened. But by and large, I want to restore that knee's ability to be a knee and do what a knee needs to do.
Sure.
So that's a big part of it, getting away from a very specific diagnosis and thinking that, oh, it's this, then I need to do these list of exercises only.
Mhm.
Um, I also think a big issue is just how underdosed rehab is and
Mhm.
how most places are not actually doing something that would stimulate a true physiologic adaptation to occur,
Mhm.
which is what you know better than anybody as a strength coach and a personal trainer is your clients aren't getting results unless they're doing something hard enough for actual changes to occur to their tissues. And the same thing goes for rehab. It seems silly that we even have to say that. Like somebody with an injury who has less strength somewhere,
Mhm.
how are we not doing everything we possibly can to actually make sure we're creating a tissue adaptation with the load that we're implementing? It doesn't make sense how that doesn't seem like it's something that is important. And the secondary to why that's so important too is the psychological side of it. Most people who are in pain are terrified.
Mhm.
And rightfully so, pain sucks and we don't want to experience it.
Mhm.
But if we do stuff that's so low level and so basic that I'm not actually challenging their psychology to recognize that they can do more,
Mhm.
then not only am I keeping them weak and under trained and under muscled, I'm also keeping them scared, and that's not helpful either. So those are the things that stand out the most to me.
The thing I see with a lot of the physical therapy office around, and I wish there were more physical therapists like you in my area to refer to, because there's a lot that's outside of my scope. I can't diagnose or treat pain directly. I can help people work around it. I can kind of throw stuff to the wall and see what sticks to generally help with a certain issue, but I'm not going to say, this is your problem, this is how you fix it.
Hmm.
And I'm certainly not going to do any manual therapy because techniques I just don't know. I'm not going to grab a Theragun and hope for the best, you know?
Yeah.
Um, but along those lines is you just see people trying to recover with, the bands or, maybe some little ankle weights, clamshells, bird dogs, stuff like that. That's not terrible in the beginning if that's a person's entry point, but if that's where you leave them, they're going to get hurt again, or the pain's not going to totally go away, especially when you work with athletes. If someone got hurt because they got trucked in sports, and then you have them lifting 10-pound, pink dumbbells or something like that,
Yeah.
and you say, let's go right back into sports and all stuff. Sports, the forces are so violent and chaotic and random and not controlled. You're not preparing them for even 50% of what that is. They're not recovered enough to go back. And I tell people, I don't even think 100% recovery is ideal in a lot of injuries because that's the level to which you got injured in the first place. If you want to become more
Hmm.
resilient and not repeat the injury, you actually have to be stronger than what you were in the first place. So I think kind of when I share that advice with people, again, not in a true physical therapy sense, but just in a resiliency sense, it kind of gives them the courage to be a little bit braver, realizing that until they reach a certain level, they're not fully recovered. About 9 months ago, let's see, September last year, so almost a year ago, I snapped my MCL in jiu-jitsu in my second ever session.
Second
And
ever.
second ever
Oh,
session, yeah. It was on a takedown. Somebody just like twisted my knee inwards. I felt it, I heard it, and it was grade three. And I was reaching out to all the physical therapists in the area to try to work with someone as quickly as possible. And there wasn't anybody available at that time for like 6 weeks. And I didn't want to wait 6 weeks to start rehab. And so I just looked up some good foundational stuff online. I think it was E3 Rehab. You
yeah,
put
they're
some good stuff
great.
out there, yeah. And I just did a home program, and about 2 months I was about 100% recovered. And there's no wood to knock on here, but it feels just as good as my uninjured knee because I just every day did as much as I could. I was maybe 20% on the weaker leg, the injured leg, and I just kept working until they were both 100%, and then I got stronger from there. But I just wish that was more common to see that level of strength building because people see PT as light and easy and strength
Hmm.
training as really hard. And if there's that big middle, that's just a terrible thing within the industry. I find that your job is my job and my job is your job, just at different stages.
1000%. Yeah, I couldn't agree more. I think, you know, the we tend to be a place at Old Bull where people come because they've tried stuff before and
Yeah.
it didn't work.
Hmm.
And the common theme of all of that is they got to a point where they were okay, but
Hmm.
then they had no understanding of how to get back to the things that they wanted to do.
Yeah.
And kind of the verbiage that we use in the PT world is getting somebody like within normal limits. Like, what does that even mean? And it's
Yeah.
just this very general statement that often basically signifies to an insurance company that this person is like okay enough to be a human and like just exist.
Yeah.
And to people like us who practice the way that we do, that is so unacceptable. People
Mhm.
who come in with these goals and they have no idea still how to get to the other side of it. And that I like that thought of, you know, getting to 100% shouldn't be the goal. It should be beyond that. And
Mhm.
so much of the things that I work on with people is kind of the perfect storm scenarios that maybe lead people to experiencing pain, where maybe there's some things that for a very long time in their exercise program their body was never exposed to,
Mhm.
or muscle groups that they never really prioritized, or a type of contraction speed that they never did, or just getting out of the same plane of motion. And those are all opportunities to just help this person be a more well-rounded person to tolerate all of the demands of life. And that's where that kind of getting them to 110% comes in, because we maybe identified the things that they weren't doing before and now we're building those into their program. And not that we can 100% prevent injury or predict it, but we can create a body and a mind that's quite resilient to be able to at least handle whatever life inevitably will throw at them.
Mhm. Um, a kind of good example is you never know what your body is going to be asked to do on any given day. One of my
Hmm.
clients took his son on his 21st birthday to Vegas, and they thought they heard gunshots and had to sprint a couple blocks. And my client had just recovered from either meniscus surgery or just a total knee replacement. I can't remember which one it was. And we've been strength training and helping, and I was working alongside a physical therapist nonstop. But you don't get to pick when you're running for your life what day that's going to be,
Yeah.
and that's a little bit more challenging than maybe a 20-pound leg extension. So it's
Yeah.
one of those
Yeah.
things
Yeah.
where, yeah. So good enough is good enough until it's not, and that's why it's
I
important
like
to
that.
just be as strong and
Yeah.
resilient as possible. Yeah. So let's see. Um, on the flip side of, sure, there's some negative things happening in the industry that you would like to see change. Is there anything positive that you're seeing? I guess a positive trend within the physical therapy space.
I think that, or, you know, it could be part of just the bubble that I'm in, but I do think there are a lot more options now than there ever were before for people to get the type of care that you and I are talking about. There's definitely more of a shift toward like the hybrid style of rehab and training, which again, I think is silly that we even have to say hybrid, because as you mentioned,
Yeah,
I do your job, you do my job. Like we do the
yeah,
same thing. It's just like what entry point we're getting somebody in at. And to say hybrid implies that they're still different, so maybe we have to think of a different word. But to more of just blending the worlds that shouldn't need to be blended in the first
yeah,
place. And I think that's happening more. I also think like the newer generation of clinicians that's coming out, because they are in PT school at a time where social media is really prevalent, they're
mhm,
getting more exposure to types of settings like ours that when I was in PT school, I didn't get exposure to. It wasn't really a thing. Like Instagram PTs weren't really a thing.
yeah,
And getting access to that and seeing that, I think is really cool and opening doors that maybe didn't exist before. Um, I also think there's more collaboration happening, more conversations like you and I are able to have. And again, like I wish there were podcasts when I was in school that I could
yeah,
listen to. Like I think that would have been really empowering and exciting. And but I think that is a very cool side of this newer generation of clinicians, the access that people have to just seeing stuff online that didn't even exist when I was in school and before I was in school.
mhm. Yeah. To speak to that, I guess I have two things to say. One is I am a solo entrepreneur, so it's just me. It's my business and power performance, and I live in a small town. The whole county is like 3,000 people, and so there's not a lot of people around me that I think are peers that I can speak to and relate to and all that. Social media, as terrible as it is in some instances, can be a wonderful thing in others. Because I'm able
Yeah.
to meet people like you know, connect with all these different coaches, and the podcast has been huge. But people also like to think that social media is not a valid educational resource. That has to be academic studies and it has to be textbooks the entire time. And while that stuff is great, I've learned maybe just as much, if not more, DMing coaches I respect or
Yep.
seeing some of the really intelligent posts or videos and explanations than I have anything else. And I think this is also a great resource for hopefully you know main people that will be listening are clients and friends and relatives of mine. And if you share anybody that you have on your platform, them as well. Um, but I want it to be something that's digestible to not only people who are aspiring to work in our fields, but also just the people that we work with day to day. I hope they can learn something from this podcast and provide value that way. Um,
Yeah,
and then
absolutely.
slightly along those lines, you're talking about the positive sides of the hybrid, physical therapy. Not to give credit to another physical therapist, but do you know Dr. Susie Spurlock?
I love her.
Okay,
Yes.
so yeah, she was also on the Coach 'em Up podcast. Shout out to Riley. I'll have to get both of them on the podcast at some stage. Um,
Yeah.
but I think she said that a red flag is if a physical therapy office doesn't have like heavy free weights or a squat rack. And I think if that's one thing I can tell clients if they're looking for a physical therapy office is, you know, are the carpets on the ground? Are there
Yep.
just like, massage tables everywhere? Do they have almost no free weights whatsoever? That might not be what you're looking for if you're trying to be resilient. Do you see squat racks? Does it look like it's, you know, for NFL athletes and all that stuff, this big crazy gym and all that stuff? That might be your place. Um, one more thing as well. Those are all my questions. I want to give you credit because I asked clients and relatives for questions. I've asked for
Oh,
suggestions with
cool.
other people before, and no one has had as many questions as what you have. Everybody wants to ask you questions, and I don't
Oh,
want
that's
that.
so cool. What a good idea.
So I have to go with my mom's questions first because I'm a terrible son if I don't. But so she said, when you have an injury, is it safe to work out? For example, cervical issues with muscular soreness compensating to protect the vertebrae. She wants to know if it's okay. She has neck
Great
issues. She's like,
question.
is it okay to work out with that?
Yeah, great question. Yeah, I would say obviously none of the things that I'm going to say are going to be direct medical advice, just more really general
General.
statements too. And so I'd have to know kind of what the big triggers and symptoms
Mhm.
are. But unless she has any red flag symptoms or has been told that she should not do certain things because of something that would be unstable or dangerous, a lot of things that would be fair game would be lower body training should feel pretty great for her. Any sort of thing going on cervically speaking, you know, just general aerobic activity is always a pretty fair game and really great in terms of nerves like blood flow and contraction, and that's a great way to get that to happen. Um, Finding entry points would be the biggest thing. Most people who have cervical issues are told immediately, blanket statement, don't ever do anything overhead pressing. There's a lot of angles and a lot of ways that we can get a more vertical trajectory for strengthening those muscles that doesn't have to be a barbell over your head. So kind of the general rule of thumb is I like to find kind of a list of all of things that people can do without symptoms and really prioritize those. And then also start to gradually introduce things that maybe are a little bit more uncomfortable. But there isn't anything completely off limits that would stand out to me. It would be more of finding that entry point, especially for things that typically would be more difficult for any cervical issue, like overhead pressing. But there's plenty of patterns and ways that you can get an overhead press in without it being what we think of when we maybe think of a traditional movement. Yeah.
Yeah, so kind of piggybacking off that, I trained her earlier today, and she was doing belt squats and landmine presses at an angle instead of all the way
Yeah.
to make it overhead.
Love
But the
that.
cardio thing, if you can convince my mom to do cardio, you know, I'll pay $1,000 because you know, I talked about how it's so good for her heart and lungs and all that stuff. Everybody thinks cardio is the best thing ever for weight loss. It doesn't beat a healthy diet, but it's super important for having a healthy heart and lungs. And I don't think people care enough about it because they can't see it.
Yeah.
But I think it's pretty important. And then I also find it kind of silly that strength and power athletes don't think they need it.
Yeah.
Um, there's many reasons why they do need it, but let's say you're a strength athlete and you can't get through heavy sets because you just get too fatigued and exhausted, or you want to get more density and you're too tired. How about a better cardio system?
Yeah,
for
that's
a lot of different
entirely
reasons.
aerobically
Yeah.
mediated, like our recovery between hard stuff. But yeah, anything nerve related, like
Mhm.
one of the lowest hanging fruit, indirect ways to help
Mhm.
is just aerobic activity because it is immediately shunting so much blood flow everywhere. Lots of cerebral blood flow, which is important for nerve pain too. And the nerves, they just respond incredibly well to blood flow and contraction. So like cyclical contraction of aerobic work, it's
Mhm.
very very good stuff.
As soon as I post this, I'm sending it right to her. You hear that, Mom? You guys taking your cardio.
Perfect.
The other thing she asked is, while working out, if you trigger a spasm, how do you treat that acute issue?
Great question. So with some sort of like muscle spasm, a muscle spasm is often going to happen when you've contracted a muscle and shortened it really hard and
Mhm.
asked it to do something difficult, or as a reaction to maybe doing something where you've lengthened a muscle a lot and asked it to do something. So that's kind of when we'll see that stuff happen. A lot of times, just general things to calm an area down is stopping for a moment and doing some deep breathing and seeing if that just helps like the tissue relax. Um, Additionally, I'm a big fan of isometrics when things
Mhm.
get kind of acutely triggered in real time. Isometrics are the safest type of contraction we can do. I always tell my patients it's the first type of contraction I'm allowed to do when somebody comes in after surgery. So if it's safe for after surgery, it's safe for us. And just contracting and breathing through that contraction is a really great tool to get some blood flow to the area. There's also some interesting kind of analgesic effects because of that blood flow. So that's typically like a strategy I would implement with people. And then otherwise, if it's something where maybe that body part isn't going to tolerate anything else that day, to move on to another body part that will.
Mhm. For anybody listening, if you don't know what isometric contraction means, it just means tension on the muscles without lengthening or shortening it. So if you just think of like a plank or a wall sit, that's a very common example of isometrics, but it can be many other things: push-up holds, bridges, split squat holds, stuff like that. Along those lines too, I like how you say that if something hurts, it doesn't mean suddenly a workout's done, go home. It means you can train everything else that doesn't hurt. Um, I try
Sorry,
to
we
teach
just got
people.
thunder, so you'll hear my dog bark for a second. Yeah.
Um, yeah, I tell clients that if, let's say, your left arm hurts for 3 months and you don't work out, and then it feels better, then your right arm hurts for 3 months, and then your right leg, and then your left leg, you just never train. But if your left arm hurts and you work your right arm, your right leg, your core, your left leg, and all that stuff, there's still plenty that does work. So if you want to be consistent throughout the course of the year, sometimes you don't work out the thing that hurts if it's really that bad acutely. Eventually, you do have to lean into the pain a little bit and try to rehab it. But there's still, I tore my MCL, and I thought, okay, I didn't think I have one bad leg. I thought I had one good leg and two good arms, and that really helped me to recover quicker. At this point, Katie had to hop off the call, but we really appreciate her being on the episode, and we hope we can have her on for another episode in the near future. She was an incredible guest, and I hope you guys enjoyed listening to her as much as I enjoyed talking to her. If you have any guests you'd like to have on the show in the future, please send me a DM at Empower Performance One. And if there's any topics you want covered, again, same thing, send me a message. Thank you very much for listening. I hope you guys have a great day.